and joining with me are three amazing panelists, and we are going to talk about an amazing topic about that is body aches during pregnancy. Well, we often hear from a expecting mom that she has been having a back pain or a leg pain, but what changes are going inside her body and how is changing on a day-to-day basis. Joining with me are three experts who will be sharing their views, their opinions, and they will be explaining us onto how these pains can be given a relief. So I welcome Dr. Pradnya, Dr. Nitu, and Dr. Sabiha to this platform where this discussion is going to be a fruitful and a meaning one. So on behalf of BabyChakra, I welcome you all, doctors. Dr. Pradnya, would you like to say something about yourself, please?
Yeah, hi. My name is Dr. Pradnya Supe. Agrawal. I'm a gynecologist. I practice in Telugu, and I'm also a certified lactation consultant as well. I'm a practicing obstetrician and gynecologist, and I have an Insta handle called Dr. Pradnya underscore gynecologist. So that's about it.
Thank you so much, Dr. Pradnya. Dr. Nitu?
Thank you for having me, Pooja. This is Dr. Nitu Verma. I'm a physiotherapist, chiropractor, and osteopath. I'm practicing in Raipur, and my clinic name is Light 360. And yes, we have been working on antenatal, postnatal things.
Right. Thank you so much. Dr. Sabiha, can you please tell me about yourself?
Yes, surely. Hi, everyone. I'm Dr. Sabiha, diet consultant. I practice in South Mumbai, and I am a certified, I am a clinical dietitian, you can say naturopathy doctor, and I have my online globally practice, that is the Nutri Guide by Dr. Sabiha.
Right. So, when we are having this meaningful discussion, I would like the viewers to ask us questions in the comment section, and we will be taking these questions live. So, this will be helpful for our live chat, to have our concerns solved with these doctors, right? So, Dr. Neetu, I would like to to
Yes.
understand, when we speak about body aches, what are the best ways that we can understand them, and how do we start easing our body pains? So in a generalized way, can you help us over here?
Keeping in short, I would say that mobility is the answer. The more we move, the more there is lymphatic drainage, there is more of blood circulation everywhere, and this is a natural way we can keep ourselves guided from general body aches and pains. So yes, the first thing is general mobility. जितना आप move करेंगे, जरूरी नहीं कोई specific exercise under some supervision. If everything is going fine, you can just keep moving, whatever suits you. Walking, cardio, yoga, but mobility is the answer.
Okay, thank you, Dr. Neetu. Dr. Sabiha, I would like to know something from you. When an expecting
Yes,
mom
please.
is in her second trimester, third trimester, she's craving for foods, and at the same time she's having a lot of body pains, and suppose she's having a lot of discomfort. So, what are those comfort foods which help her to reduce these body pains, or could divert her attention? Can you throw some light over here?
Yes, surely I can. See, during pregnancy, it's very emotional and psychological phase for the mom. So it is not, one complaint is similar to everyone. It totally depends on your body and your hormones and everything. So surely I can say this related to this body pain only not the nutrients, but there are nutrients deficiency or lack of nutrients which can lead to body pain. The thing is, just say I can say lack of protein in the diet, low level of vitamin D, which is most important, low level of calcium, low level of iron and all these things. So this is not only one thing I can say, it is a compact and impact of nutrients in the body in such manner.
Oh.
And if you will talk about, to reduce that and all for the pain, though I can give you, there is a one unique and wonderful result which I suggested to my sister also. Apply castor oil. it really helps for the body pain during pregnancy.
Okay. Thank you, Dr. Sabiha. Dr. Neetu, coming back to
My
you.
pleasure.
When we talk about pain, we are saying, body aches, back pain, very, leg pain, swelling in the legs. तो ये सब बहुत ज़्यादा कॉमन प्रॉब्लम्स होती है और जब इसको रिजॉल्व करने जाते हैं घरेलू नुस्खे तो होते ही है बट गोइंग टू अ डॉक्टर गेटिंग इट ट्रीटेड इज समथिंग नॉट डन बाय मोस्ट ऑफ द moms expecting moms. So what is your way to address these problems and how can what is the solution to resolve this? Can you share some
Okay,
light over here?
see, there are two things. One, I would like to clarify that it's absolutely safe to ask for help from physiotherapist. Okay, physiotherapist, we work superficially on your muscles, ligaments and tendons and everything. तो फिजियोथेरेपिस्ट से हेल्प लेना इट्स एब्सोल्युटली सेफ.
Okay.
देयर इज नथिंग लाइक रेडिएशन और एनीथिंग, क्योंकि अगर वो रेडिएशन भी यूज करते हैं तो दैट इज थेरेप्यूटिक फॉर थेरेपी पर्पस. वॉट एवर द बॉडी इज इंटेंट टू टेक उतना ही फ्रीक्वेंसी उसमें होता है. तो इट्स एब्सोल्युटली फाइन टू टेक हेल्प फ्रॉम फिजियोथेरेपिस्ट. एंड सेकेंड थिंग इज होम मैनेजमेंट. आप घर पे उसको कितना मैनेज कर सकते हैं तो डिपेंडिंग ऑन द कंडीशन. बट वन जनरल थिंग आई वुड लाइक टू से, सपोज लेग्स आर हेवी
Correct.
या लेग्स में स्वेलिंग है, इडीमा है, तो द बेस्ट वे इज आप जब भी आप बैठ रहे हैं तो नीचे की तरफ पैर लटका के नहीं बैठेंगे. डोंट हैंग योर लेग्स व्हाइल सिटिंग फॉर लॉन्ग. And
Okay.
whenever you're taking rest, whenever you lying down, keep your legs anti-gravity. जितना gravity के against रखेंगे तो circulation will come back to the main portal vein. तो हमको एंटी ग्रेविटी मतलब पैर ऊपर चढ़ा के 2-3 पिलो के साथ पैर को ऊपर चढ़ा के रखें, एलिवेटेड पोजीशन में रखें. तो दिस विल हेल्प रिड्यूसिंग लिम्फेटिक ड्रेनेज. और जब लिम्फेटिक ड्रेनेज सर्कुलेशन बेटर होगा तो अपने आप हेवीनेस पेन भी जाएगा. And if you talk about specific calf pain and cramps or swelling, then or varicose, yes, then we can say कि अब हम उसको एडवाइस कर सकते हैं. बहुत सेफ है कॉन्ट्रास्ट बाथ. कॉन्ट्रास्ट बाथ इज गाइस, take 2 buckets of water. One is hot, lukewarm, and put some salt in that. And cold means proper cold, like आपने उस water में ice cubes डाल के उसको cold किया हो. तो take contrast bath and अपने calf तक दोनों उसको dip करना है. तो both the legs in hot water for 3 minutes. So 3:1 is the ratio. 3 मिनट पैरों को गर्म पानी में रखना है. देन इमीडिएटली उसको 1 मिनट कोल्ड वाटर में रखना है. सो देयर इज वेरी जनरल थिंग कि जब भी कोई चीज गर्म होती है तो वो डायलेट होती है, एंड अगर कोई चीज बहुत ठंडी हो जाए तो वो तुरंत कंस्ट्रिक्ट होती है. तो बार बार डायलेटेशन एंड कंस्ट्रिक्शन से वहां पे पंपिंग शुरू हो जाता है काफ में. तो लिम्फेटिक ड्रेनेज एंड बैक टू विनस रिटर्न ये बहुत इजी हो जाता है. एंड देयर इज इमीडिएट रिलीफ फ्रॉम पेन एंड स्वेलिंग एंड इडिमा, सो दीज आर द होम रेमेडीज. एंड एज आई सेड, मोबिलिटी, जितना आप एंकल टो मूवमेंट करेंगे बैठे बैठे उतना अच्छा रहेगा. सो 3 थिंग्स, एंकल टो मूवमेंट्स एंड कॉन्ट्रास्ट बाथ. कॉन्ट्रास्ट बाथ लेने के बाद आपको चलना नहीं है. फिर एलिवेशन, पैर को एंटी ग्रेविटी चढ़ा के पिलो के ऊपर रखने के लिए रेस्ट करना है. दैट्स इट.
That was a very meaningful answer. Thank you, Dr. Neetu. And the contrast bath is something new thing that I learned. So definitely I'm going to keep it in mind. So coming to you, Dr. Pradnya, what are the common causes that a mom should understand, during the body aches, which is happening during the pregnancy? Can you just highlight over here?
Yeah. So sorry, I think there was some issue with my connection. So I think body aches is a very common issue. All pregnant mothers do get it. I think it's important for every mother to know why does it happen. So there is a hormone in our body called relaxin, which is secreted more in pregnancy, जो हमारे ligaments को relax करता है. Because of that, all this pressure, because of the focus of gravity changes, and there is something also called as round ligament pain. because when the uterus starts growing in size, it comes out of the pelvic cavity. जैसे आपके uterus का size बढ़ जाता है, तो आपका uterus in the body, it is held by a round ligament. वो stretch हो जाता है. So that kind of stretching pain is also very common. And
I think we lost Dr. Pradnya. So we'll continue with Dr. Sabiha. I would like to ask you a very simple question that, a mother and an expecting mother faces discomfort due to bloating and due to gases. So what are the ways, we can help her to relieve this kind of a pain? Because when the tummy is growing from 6th to the 9th month, there's a lot of discomfort and that causes a lot of pain. So can you help over here?
Yes. So I can put my hospital. It will be surely very soon to remedies which everyone can follow it. It is not which is to follow. I can say the most important thing, family soft child, which is really helpful during this kind of phase. And I can say for second is good sleep. This is really important because अगर आपका sleep ठीक नहीं है तो all this discomfort happening in the body. Then I can say hydrate yourself because dehydration is one of the most important things which lead to all these things. And I can say use healthy oil in the food. It can be cold pressed oil, which is really helpful and healthy for the body. And you can say test oil wrap, which is very essential, like in life also and also, and of course less stress. So it can help solving this very important thing.
Okay, so Dr. Sabiha, I think there was a little network issue from your end. So I would just like to repeat it that, having a good sleep, having a low, medium oil kind of foods and having less spicy foods would help the mom to be having a good comfort.
Yes.
Yes.
Along with medium oil thing is the quality of oil. That is the I can
Okay.
cold pressed oil, healthy oil. Yeah, that is most important.
Okay, so cold press oils or healthy oils, and they can choose over better options, which will be helping for
Exactly. Yes.
relieving the acidity, and then the body pains would be going down. Okay, that's a
Yes.
wonderful way.
And
Dr. Neet,
and use turmeric also, turmeric powder, in water, and all this thing, it has an relief from all this pain and acidity.
okay,
Water, gas, whatever you
got
say,
your
yeah.
point. Yeah, Dr. Neetu, coming to your point, understanding regarding the body pains, when it is pain in the ribs or, there is a lot of back pain, the discomfort levels goes to an extreme limit at a point of time. So what are the ways expecting mom can help herself to relieve this kind of pain? Can you suggest some things over here?
See, lower ribs pain is something which is very mechanical just because of because of the baby bump. If you can all see, because of the baby bump, the ribs tends to get lot of pressure, upward pressure. From its original place, it tends to go up. So this is something mechanical. ये mechanical pressure के कारण है, तो you just need relieve this mechanical pressure as much as possible. So don't sit in slouch posture so that your ribs are resting on the baby bump. Try to sit straight as much as possible, and then you can search on net, do some stretches where we can distract the baby bump and ribs away. So you can do some stretchings like if you all can see some stretchings like this, where it will go away from the baby bump. So I think this is the best way. And if you're lying down, keep your arms away overhead so that there is a place for rib cage to flare up, and that
Right.
way we can relieve it from the baby bump pressure. So that way we
Okay.
can relieve the pressure from the rib.
Thank you for giving us those demos, because explaining it to the mom over the calls is definitely very, very helpful. Dr. Pradnya, coming to you, we were trying to understand the causes, but I would also like you to tell us that is body ache normal in pregnancy? What
Yes.
is your thought over here?
See, definitely, I completely agree with Dr. Nitu that there are a lot of exercises which can relieve this body pain. But yes, some amount of body pain is very common in pregnancy. And I think every pregnant woman should understand that there are very small things that she can do which can help her counteract this pain. One of them is restricting how much weight gain she has during pregnancy. So, a normal pregnant woman with a normal BMI, when her BMI is between 22 to 35, which is as per our Indian standards, should have a weight gain of at least 9 to 11 kgs, somewhere between that. If her BMI is above 35, she should have a weight gain somewhere between 7 to 8 kgs. If it's much less, if she's undernourished, somewhere between 12 to 14 kgs. So that is the first thing, that the weight gain should be kept in check. Secondly, if her gynecologist permits her, if there are no problems, no complications in her pregnancy, she should try and be active in her pregnancy as well. Means this will also help to keep the body aches to a minimum. So by active, she can do walking, any other exercise. If she's somebody who has been continuously exercising even before pregnancy, it's always a good idea to be active. The only problem being if a gynecologist has given her the go ahead to be active and do exercise in her pregnancy.
Okay. One more point I want like you to highlight over here, Dr. Pradnya, is that growing belly sometimes puts pressure on the expecting mom. So how does she may understand whether that pain is a body pain or it is getting into labor? So can you
Yes.
just put up a differentiation
Yes,
here?
definitely. So let us understand one thing: body aches and all these pains which we've been talking about sometimes start as early as the first trimester also. So it's important for all pregnant women to remember that whenever this body pain or this belly pain, especially like what you talked about, if it is associated with bleeding, if it is associated with any gush of fluid, especially in the later trimester, third trimester when she's near term, it should always be taken as a flag, red flag, and she should always be visiting a gynecologist. Pain which is not relieving on the rest, even if she's lying down, she's resting, but the pain is keeping on coming. There is hardening of her belly which is not getting relieved even with the overnight rest or rest for some time. Yes, that kind of pain should always be taken as serious. She should definitely be visiting a gynecologist. Talking about the first trimester, sometimes because the uterus starts growing rapidly in the first trimester and there is stretching, yes, there is pain. When is this pain abnormal? When there is a lot of cramping, especially in the lower belly, when she is having bleeding, even a drop of spotting, it should not be taken as normal. So mild pain here and there is always okay. A pregnant woman will suffer through it throughout her pregnancy. But anything related to the red flag signs that I talked about, she should definitely be visiting a gynae.
Right. Thank you, Dr. Pradnya. Well, we are coming up to the last round of questions with all these experts. If you have any questions, please put this in the comments, and we will be happy to help you all over here. Dr. Neetu, starting up with you. When we talk about back pain, the stretcher exercises you mentioned correctly, but a person who is on a constant bed rest, how can she, be advised to in what way that her body pains get reduced during that time, because continuously being on bed would have a lot of body aches. So how would you help this mom out over here?
Okay, so if a person has some complexity and she's supposed to take bed rest, I would suggest take help of pillow, and the body tells itself which is the most comfortable position. My add-on to it is that one should just keep changing the position.
Okay.
आप नीज के नीचे पिलो रख सकते हैं. एक मतलब एक टाइम के बाद आप सीधे लेटे हैं, फिर बैक एक आ रहा है, तो उसको लोड अनलोड करने के लिए पोजीशन एक तरफ करवट ले सकते हैं. एक बार एक साइड लाइन में आ गए, दूसरी बार दूसरे साइड लाइन में आ गए. दोनों नीज के बीच में साइड लाइन में यू कैन कीप द पिलो. Straight line mein below the knee you can keep the pillow, And if there is a bump, then you can take support of the pillow with the over the bump, below the bump. And when taking sideline, you can take help of pillow to rest your hands. So that way you can take help of pillows and do some arrangements, and जो भी आप कर रहे हैं उसका ergonomically you can help yourself. So one is posture, and second is keep changing the posture. To take help of pillows, supports, and keep changing your position and set your pillows accordingly. So these two things a bedridden pregnant lady can do for self help.
Right. Thank you, Dr. Nitu. Dr. Sabiha, we have a question from one of our users. Chanda.
Yes.
She's saying that is Kesar milk safe to be taken in the last semester?
Yes, surely it can be taken. The amount should be, 1 or 2 is in a milk, not more than that. But it is safe to take.
Okay. Chanda, I hope Dr. Sabiha has answered your question. She has said that 1 or 2 strands of Kesar is very safe to be taken in the last semester of your pregnancy. Dr. Pradnya, coming to you, I would like to understand, when we talk about body aches, we talk about common causes. Which is the best way to for a mom to help her understand that this is okay and she can ask for help, because most of them have a very lot of thoughts to approach a doctor. So how would you help a mom over here?
Um, so I think every mother should understand that not all pains are dangerous, and sometimes you do get pain, you do get stiffness. So not every pain should make you run to your gynecologist. Some pains do happen. It is part and parcel of pregnancy. Like Dr. Nitu said, the rib pain that you get lower abdomen side pain as well, lower belly pain. Sometimes you have a lot of pregnant women who tell you, I get a lot of vulval pain as well. So that is because the baby is growing and somewhere the weight in the pelvis is increasing. Moreover, your ligaments are relaxing, your abdominal wall is getting a little weaker. So, obviously, back pain, which is the most common pain that most of the women get, so it does happen. What is important for a woman to understand that she does need to rest. Even if she's having a low risk, uncomplicated pregnancy, ultimately, pregnancy is a stress. It's a stress for the body. So she does need to rest. She does need to avoid standing for long periods of time. Her legs, like Dr. Nitu had suggested, keeping them, against gravity, keeping a pillow below your legs, especially when you're going to sleep. If she's at a desk job, like how we are sitting, if she's sitting for a prolonged period of time, that itself can increase the leg pain and the swelling of legs also. So just elevating the legs for some times. These are small practical points which Dr. Nitu has already mentioned. But whenever, I would just like to say, whenever the pain is not getting relieved or associated with bleeding, or something like an intuition, she feels this is something that is not normal, I've never gone through this before, she should trust her intuition and then go to a gynecologist and show her. That's for sure.
Okay, thank you, Dr. Pradnya. It was a very thoughtful answer. Well, I thank the panelists, Dr. Pradnya, Dr. Sabiha, and Dr. Nitu for answering questions. But before we conclude, we would like to understand, a home takeaway message, like a home message for every mom who is listening to us. So, starting with Dr. Nitu, what message would you like to give our viewers over here?
Just enjoy this enjoy this miraculous period of your life. Forget this pain, it's just temporary. These all body aches are temporary. Enjoy it throughout, manage it somehow, and it's gonna be beautiful at the end. So mobility is the answer. Do remember that.
Thank you, Dr. Nitu. Dr. Sabiha, would you like to add on something?
Yes, I will surely. First of all, I would like to congratulate to everyone, would be mom or those who are planning. Second thing I can say, the ultimate circle is bloating, pain, and all these things. So I just said few points which is very everyone can follow. You can take one you can just consume one fresh amla whole day. That really helps to I can say all these things, whatever we have discussed. Second, I can say your sleep. Sleep is very in this phase. So I can say, 2 at night you can add in your diet, which is equivalent to 0.3 milligram melatonin, which really helps to sleep. Melatonin is the, I can say, हमारा key है sleep को regulate करने के लिए. Third, I can say fermented drink rather than all these, medicine and all. You can take rice fermented water, which need to be made in such manner. 2 to 3 tablespoons cooked rice. You soak in a glass of water for 7 to 8 hours, cover the lid, then consume in the morning. It really helps all this bloating, acidity, all these things.
Okay, thank you, Dr. Sabiha. वो नुस्खे बहुत ही helpful थे, and we'll definitely
Thank you so much.
recommend it to the
My
moms,
pleasure.
expecting moms who are taking it. And Dr. Pradnya, coming to you, the last
Yeah.
takeaway.
So what I want to say is that, see, body aches are part of a normal healthy pregnancy as well. A pregnant woman should never be worried. What she should focus on is keeping herself well hydrated throughout her pregnancy,
Very
consuming
true.
at least 2 to 2.5 liters of water in a day, have a good protein rich, iron rich diet, because she does need that protein for her and baby's growth. She needs to have her, prenatal vitamins as supplements on time, the way her doctor has advised. And most importantly is that she has to be active unless advised by her gynecologist. Activity can be in any
Exactly.
form. See, most of the women have a mindset that we cannot exercise during pregnancy, it will harm our baby. So she needs to understand that exercising in moderation, let me put it this way, anything in moderation is never going to affect her. So little bit of exercise, a walk, maybe 15-20 minutes a day. If she is somebody who has been actively exercising before, she can continue with the same, definitely under supervision and after a gynecologist advice. So I think that is the key factor to keeping the body aches and pains as minimum as possible.
Well, very well said, Dr. Pradnya, Dr. Nitu, and Dr. Sabiha. When we are talking about body aches, we have to understand that this is a part of our body and our life cycle. So we can deal with it with ease without any stress. And when in pain, we need to ask for help. With this, we would like to conclude our session, and I hope that the Baby Chakra community is all blessed to have such beautiful thoughts from these doctors. I personally
Thank you
would
so
like to
much.
thank all these doctors for joining us, taking time out of their busy schedule and making this panel discussion happen in a very beautiful way. Thank you all. It was lovely having you on board.
Thank you, Dr. Pooja.
Our
It was really
pleasure.
being part of this.
Yeah, it's really nice to connect it with all of you.
Same here, ma'am.